A very good evening to each of you. I am Rakavi, psychologist and educationist, currently leading the research and development vertical at Mitra. I extend a warm welcome to this conversation that sits at the intersection of science, tradition, and care, that is the Maatrutva resilience. We gather today to honor and support the emotional journey of mothers, a journey that often goes unseen and unspoken. Our focus is to offer structured, compassionate, and evidence based care to women navigating pregnancy, childbirth, and beyond. At Mitra, we are working to democratize access to mental and emotional well being. Our holistic, tech enabled programs are built for every stage of life, blending psychology, yoga, Ayurveda, and family centered care. Here's a glimpse of our core programs: igniting minds, postures, emotional resilience, and academic agility in children and adolescents through integrative tools such as cognitive development and emotional regulation, and not the least, the mindfulness. Then comes the Serene 30, supports working professionals in managing stress, burnout, and mental fatigue through short format therapy, yoga, nutrition guidance, and digital tools. The third program from Myth is Healthy Aging, enhances the emotional, cognitive, and physical well being of elder adults through movement mastery, memory building, emotional expression, and peer connection. And the last but not the least, the reason behind our webinar today, that is the Matru Resilience, a holistic maternal wellness program that supports expecting and new mothers through personalized counseling, prenatal and postnatal yoga, Ayurveda, nutrition, family education, and community engagement. We are honored to be joined this evening by three esteemed professionals whose experience span clinical psychology, gynecology, education, and community engagement. Their voices enrich our understanding of maternal well-being in nuanced and practical ways. Let me introduce Sonia ma'am. Ms. Sonia Bhatia, counseling psychologist, educator, nutrition graduate, and a trainer. Works with women across stages of family planning, especially in remote or unsupported settings. Dr. Sandhya Rani, gynecologist at Aster Women and Children Hospital, Whitefield, specializes in adolescent and menopause counseling and high-risk pregnancy management. Nikki, clinical psychologist, 7+ years of experience, MPhil from BT Sharma PGIMS, and a gold medalist, works extensively with children, adolescents, and mothers. Let us now begin our panel discussion with our esteemed guests. Each of them brings a unique lens to maternal well-being. We'll explore a range of emotional, medical, and social aspects through specific themes and questions directed to each expert. Let's begin with Dr. Sandhya.
Yeah. Hello.
Yes, ma'am. Hello, ma'am. Good evening.
Good evening.
Yes, ma'am. The question for you is, what emotional challenges emerge in early pregnancy, and how can medical systems begin supporting mothers at this stage?
Right. So, like you said, the medical and the social aspects always go together as far as pregnancy, gynecology, or obstetrics is concerned. So, specific to early pregnancy, what I observe in my practices, especially the first time moms are usually the ones who have a lot of anxiety, a lot of questions, a lot of apprehension as to how the pregnancy would go ahead. Coping up with the first trimester symptoms. As we all know, that is the phase, the first 3 months, where body undergoes a lot of changes physically and emotionally. So coping up with them is always a challenge. Additional hormone-induced mood swings add to their problems. So what I feel is, obviously, we do give them some medical support in the form of medicines to cope up with their first trimester symptoms. But the preparation for the pregnancy makes a difference. So I would advocate something like pre-pregnancy counseling, where women who are planning for pregnancy first reach out to us, try to get as much information. Of course, we can't prepare them for everything in pregnancy, but at least the basics, help them understand this would be the changes, this is what is expected, this is what may happen. So they are mentally prepared to cope up with all this. So medical part is important, and at the same time, counseling, pre-pregnancy counseling, giving them the right medication in the form of supplements, help them prepare like what we usually do is we see their weight. If they are overweight, we counsel them about weight loss prior to pregnancy. If there are any vitamin deficiencies, correct them, and then ask them to plan for pregnancy. And this would make their journey easier.
Right. Well said. Agreed. Thank you. The next question to Nikki. What early psychological signs might indicate emotional distress in expecting or new mothers, especially those families often overlook?
Yes. So these signs and symptoms can be detected quite early, even before the mother conceives, and these can be divided into emotional, cognitive, and behavioral. When we talk about emotional signs and symptoms, it basically includes maybe overwhelmed, टू मच ऑफ इमोशंस टू से इन कॉमन लैंग्वेज बहुत ज़्यादा खुश होना या बहुत ज़्यादा उदास होना, ये दोनों ही सिम्टम्स बेसिकली हमें नोट कर लेने चाहिए व्हेन इट कम्स टू इमोशनल क्यूज। या फिर किसी से बात नहीं करना, अकेले रहना पसंद करना, या किसी की कॉल्स आती हैं आपसे बात करने के लिए, नॉट पिकिंग अप द कॉल्स, trying to just be into yourself. These could be the emotional cues. Then anxiety, depression, helplessness, hopelessness. Will I be able to be a good mother? Will I be able to take care of the newborn? Will everything be fine? ये जो questions आते हैं, it comes to everybody. Excessively जब ये आना start हो जाते हैं, this is where emotional concerns should be spotted and should be acknowledged. Then comes to behavioral symptoms. Behavioral symptoms may usually we focus on self-care, sleep, appetite, and daily functioning. If the daily functioning is hampered, thinking a lot about the pregnancy and not able to engage herself in the day to day activities, then not taking care of yourself, the basic hygiene, not taking bath or not trimming your nails, the very basic things, not changing your clothes, just thinking about your pregnancy, and then coming to appetite, eating too much or eating too less. These are the behavioral symptoms that should be focused upon, या फिर ये वो सिम्टम्स है जिन पे अगर ध्यान दिया जाए, these could be the early detectors of emotional or psychological issues. Then coming to the cognitive symptoms, the signs and symptoms, of course every symptom may not be diagnosable, but to some extent mild moderate severity, वो सारी चीजें हम ध्यान में रखते हुए to some extent अगर हम initially spot कर लेते हैं, like negative self talk, suicidal tendencies, self harm, anxiety, panic, negative self talk like कि I said initially, will I be able to be a good mother or will I be able to take care of my child? So these are the cognitive symptoms जो हमें early stage पे detect कर लेने चाहिए. If they are present, we should give due attention to them and we should help, validate and give support to the concerned mother or the mother who is going to conceive.
Right.
Yeah.
Well said. Very thoughtful. Yes. Now the next question to Sonia ma'am. How can families become the first safe space for mothers when emotional health isn't openly discussed?
Okay. Raghavi, there was a saying that it takes a village to raise a child, right? Unfortunately, with the lives that we are leading, the village is gone, and the responsibilities on the women have only risen up, right? The present socio-cultural context that we live in, whether we are from a middle class, upper middle class, or a lower middle class family, we're all impacted by it. The upper middle class family, everybody is preferring a nuclear structure, which means that the support that could have been extended in the name of a joint family is gone now, right? And for whatever reasons, the change is there. And for the lower middle class, for the lower socio-economical people, they're all moving towards the big cities in search of occupation. So whether you're looking at laborers, whether you're looking at people who are doing menial jobs to earn money, they come to big cities, and then after that, earning money becomes the primary motive. In the midst of all this, if a woman gets pregnant or if she conceives, or if she and after delivery, she has to quickly go back to work, or she has to keep working till the end of her pregnancy, regardless of how hazardous her job might be. Now, this leads to numerous, challenges that may come in the way later on, with whether it comes to the relationship between the parent and child, because it definitely gets impacted by the mother being, extremely, frustrated or extremely overworked, which we can keep discussing on another discussion, because there are, attachment issues and other things that we hear about in psychology, that, when the mother is emotionally unavailable, things lead to, which spreads on to the next generation. So what does the mother do? She copes. And whether it is negative or positive coping, coping happens. In a negative way, she will cope by crying, by being angry all the time, by lashing out at the child, or lashing out at the people around her when she's pregnant. Positive coping, or like Nikki very rightly brought out, behavior and, suicidal tendencies or negative thoughts that might be inside her. The positive coping comes when the family is there to support her, or family is there to understand. That could be by helping her relax, by helping her, uh, you know, get a perspective of what greater thing that she's, going to do. She's going to breathe life into a living being, and that person will be taking the human species forward. So they can help her by journaling. They can help her with the help of counseling. But I personally feel like Dr. Sandhya very rightly brought about that it is very important at this stage to remove the taboo from counseling and bring the families back and talk to them about what it is that the woman is going through at a physical and an emotional level, and to help her, support her through this. Either way, the family plays a very, very important role in helping the lady, in supporting her through this, because throughout pregnancy, either, if she's isolated, she will get into depression. If there's indifference for the amount of changes that she's going through in her body, this will lead to frustration, because she is feeling that in firsthand. Whether her husband feels it or not is secondary, but she is feeling it. The change is going through her. And lastly, I would just like to say that as a family, we are also excited about the Kul Deepak that comes into our family. But the lady who breathes life into that, she should be the Roshni, na? She's the one who lights up that diya. We have to acknowledge her. We have to acknowledge the sacrifice she's made, whether it is her identity, whether the pain that she's going through, and then put her on a pedestal and give her that freedom that from where she can ask for help. So yes, family does play a very important role, and they're the ones who are going to facilitate this entire process.
I do agree. Very practical, and it's the reality. Right. The next question, Dr. Sandhya.
Yeah.
How do hormonal fluctuations impact mood, and why is awareness essential for both mothers and caregivers?
Correct. So, as we know, there is a hormonal roller coaster, which brings about an emotional roller coaster in all women. So, first trimester is the most susceptible one, especially if the pregnancy comes as a surprise. It's not an unplanned, it's an unplanned pregnancy. Or we see a lot of women, especially those who have gone through some fertility treatment to conceive. They have a lot of expectations and they have to meet the expectations of the entire family. These are the ones who take the brunt of it, and they are more prone to all these emotional outbursts. So in pregnancy, we have different hormones: estrogen, happy hormone, progesterone, which has a lot of symptoms and side effects. There is HCG hormone, oxytocin, the happy hormone. So all these play at different stages. First trimester being the most important, and towards the end of pregnancy, the late third trimester, what we call, where women develop a small apprehension. I wouldn't say anxiety, but apprehension about how the delivery process goes. So, as medical professionals, what I feel is identifying the high risk women. So, when they come for pre pregnancy counseling, we generally try to find out what kind of family they are in, what is the support system that they expect, what are they planning to do at work. Especially in places where the workplace is quite far away from their residence. We say, how are you going to manage? Did you plan all these things? So, certain amount of planning helps them cope up, certain amount of family support. So will you get a work from home? Do you have to go to office? So if you go to office, who's going to take care of things at home? So a planning and giving them an insight as to how the pregnancy journey would be will help them prepare better. But yeah, extremes of emotions in the first trimester, especially imagine a woman who's very active, who's doing very well in her career, suddenly is not able to eat well, sleep well, has a lot of nausea, is not able to perform well at workplace, obviously goes through a lot of emotional trauma. starting from mild helplessness to depression, anything can be. So, counseling, counseling, counseling. That is the one which can prepare them and help them cope up with all these things, along with medication for the physical symptoms of it.
Mm.
Well said, ma'am. Because counseling is just not any therapy or any taboo on them. You have to do it, you should do it. It's for
Right.
their sake and it's for the personal development, overall personal
Right.
development, right? To be stronger. Right. The next question, Sonia ma'am.
Yes.
What invisible emotional burdens do mothers carry, especially in socially or emotionally isolated contexts?
Oh, there's a lot of it. I think they carry first one being perfection. We are all on social media, and then the perfect pregnancy and the perfect, photo shoots and the perfect husband taking care. That doesn't happen in reality. Pregnancies are messy. There's a lot of, there's a lot of like Dr. Sandhya spoke about, a lot of nausea. There's a lot of physical changes that go through her body. She will not be able to perform. She'll not be able to understand what her body is going through. It's like, a vehicle that you've been driving all your life suddenly doesn't listen to you. When you press brake, it doesn't press brake. And when you want it to accelerate, it just won't take off. The body becomes like that, doesn't listen to you. So perfection, yes. First, the pressure of being perfect at all times, whether it is extended by the family or whether it is self-inflicted, that is something that, that needs a debate and that needs to be settled. And then not complain, do not complain. Other women are also going through it. You're not the first one to bring a baby into this world. Just because everybody is going through it, it doesn't mean that it is not a very big deal. Pregnancy is difficult. Like I said, it is messy. Then again comes the problem of like again Dr. Sandhya mentioned career. What about my career? What about my identity? What happens next? Will I be able to juggle? And like I mentioned before, not having the family support like a lot of people do in these days can be a very big question mark. What happens after that, right?
Mm.
And while everybody asks how is the child doing, or how healthy is the child, nobody asks how is the mother doing. So there's no conversation happening around it. So that needs to happen, and I think the way forward is to normalize, do not undermine, but normalize putting on weight in pregnancy, normalize asking for counseling for yourself, normalize having doubts, and reaching out for help, maybe not in family, but there is a safe space. There are some people in amongst which a woman will feel comfortable. Normalize them in. Family doesn't just restrict itself to the people we're related to. Sometimes it's the neighbor, sometimes it's somebody you've grown up with, sometimes it's a classmate who can perhaps explain something better than what a mother or a mother-in-law can, because we are more receptive towards it. But yes, there's a lot going on at the personal front, and to have that safe space to speak to someone is a very big thing. And with counseling, with the help of that, a lot of problems get solved.
Right. Indeed. Now these two questions are connected, I feel. So let us go back to Dr. Sandhya now.
Yes.
The continuation of Sonia ma'am's question and the answer. So how can the postpartum care better integrate emotional healing alongside physical recovery?
Postpartum care is something which is basically troubled in India.
Mhm.
Like she has rightly pointed out, the entire focus shifts from the mother who was well fed, well groomed, well taken care of in pregnancy, and suddenly the attention is all in about the baby's care, and very few people give importance to the care of the new mom. So, as such, there are hormonal changes, physical changes, going through a probably a difficult normal delivery or a cesarean, whatever the case may be. The woman has to cope up with that pain of post labor stitches. Upon that, sleepless nights, and some parts of India where the nutrition is also not appropriately taken care of. There are a lot of taboos, a lot of myths where women are not given anything other than bread and milk or certain foods which are restricted. So, not being able to eat a complete meal, not being able to sleep completely with the hormonal changes, these are the triggers for postpartum blues, what we call. The milder version is the postpartum blues, which definitely can be taken care of. One, by awareness. Every post delivery patient, I make it a point to talk to them that I tell the spouse that your wife would be going through all this, so please bear with them. There could be sudden episodes of crying or getting angry or triggered for very small reasons. And if it goes to a certain stage or extreme of, like pointed out, self harm or something, please reach out to the right people or reach out to us. We'll put you across to the right people. So it is family centric. No single person can deal with it. I always feel, and that is what I advocate, that the whole family has to be aware, because only spouse may or may not, because the basic caregivers would be the mother and the mother-in-law. And traditionally, we have seen there is always conflicting opinion between their families also. Ki we follow these rituals post delivery, we follow these rituals. So probably discussing all this beforehand will make sure that the woman is not subjected to any kind of difference in opinions or an unpleasant situation. Her nutrition is taken care of, her hydration is taken care of, and she will recover faster, and she will be able to nurture her child the way that she would like to.
Right. Absolutely true. Absolutely true. Right. Now let's go back to Nikki. What behavioral cues reflect maternal distress, and how can caregivers and professionals encourage mothers to speak up?
Okay. See, when we talk about, and for this, even Sonia ma'am and Dr. Sandha mentioned rightly, the system, the Indian system is disturbed so much when a mother needs her husband the most after delivery. He is kept away. So she needs somebody to ventilate her emotions. Like, okay, I'm not feeling well. I'm not able to sleep. I'm not feeling this is my body, even because even if it's a normal delivery or a C-section delivery, maybe the mother is not able to get connected with the child, or there is no bonding. She has to breastfeed even after the C-section. So when she needs somebody, she's asked to stay quiet. You stay quiet. This is how it is supposed to be. So the behavioral cues, like you talked about, it is visible in the behavior. Like I mentioned previously, also, behavioral cues basically include the appetite, self care, sleep. These are the main areas where we need to focus upon. So, along with the child, if the mother is saying, I don't feel like to eat, I need to sleep more, but she is not, I wouldn't say compelled, but she's made to breastfeed so frequently. Okay, baby is crying, you breastfeed. Baby is having this, you breastfeed. She's not given the appropriate amount of rest sometimes because the entire focus is on the child. Okay, so this is one thing. And like you asked me about the behavioral cues, so she there are verbal cues. She says, I don't feel like connected, I'm not feeling good, is it going good enough, am I good enough? There is guilt, there is shame, there is frustration, anger on small issues, and that is not being validated. So one should validate the emotions even if you are not able to do anything. Just give that emotional support. Be physically present with your partner, even if it's for some time, even if it's for 15 minutes. She should get that safe space to ventilate her emotions, to say what she's going through without being judged. That is very, very important. That emotional support a partner can give. Even if you share a good bonding with your mother in law, even she can provide with that. It's not necessary the relationship is everybody's relationship is disturbed. So anybody can do that, but she should be validated. Every feeling should be accepted the way it is. And one should look for the red flags. If the mother is trying to self harm, there is extreme negative self talk. I feel like I might hurt the baby, I might just drop the baby. If there are obsessive, there are compulsive thoughts, that is OCD, anxiety, panic attack, depressive symptoms again. If there is anything as such which is visible, which she gives through verbal cues, she talks about it, one should consider it and one should take support and give support. And it should not be ignored because it can turn into later on severe depression or prenatal, postnatal anxiety, OCD, bipolar affective disorders, which people are not aware about. So, if they consider going for counseling, therapy, definitely they will be aware about various kind of issues, psychological issues they are going through. If it is diagnosable, if the treatment can be started on time, and it can be prevented with further damage to the family, to the baby, and to the mother.
Right. Well articulated, Nikki. Now let's head to Sonia, ma'am. How can cultural practices and modern mental health care be bridged to ensure holistic support for mothers?
Ravi, like we all know, I think we're all mothers. We all know that traditional practices are, especially in the Indian society, traditional practices are taken very seriously. And while a lot of them were made with the intention to enable a woman to rest many years ago, a lot of them are now creating more panic and problem in a woman's life than helping. So I feel, we have to find a balance between what was being practiced in the past and what makes sense today. um Practices like japa, in which 40 days a woman is not allowed to go out. This is usually practiced not just in India. A lot of Southeast Asian countries also follow this. While in some societies and in some households it is a little more flexible, where she's fed and she's taken care of for 40 days. There are rural areas where she's locked up in a room 40 days. She's not allowed to go out. She's just supposed to stay there with the baby. And can you imagine, with all those emotions and hormones that she's going through, how difficult it must be for her without anyone to hear her out, with this new change in her body and this new person through whom all her priorities have absolutely been, rejigged without any prior warning that was probably given to her. So we need to relook at all these traditions. We need to have a relook at what makes sense in the current day scenario. We need to be less rigid. No doctor has ever asked a lady to be given saunf ka pani, and Dr. Sandhya will validate that. While these practices are important, I'm sure there is some weightage to it, but to make it mandatory, or to make it something that needs to be done without any conflict, or without any debate on change, would is something that troubles a lot of ladies. And I think that is where we need to balance it out with what works today, what works with the generation today, and how we can go about it.
I think I missed it.
So yeah, so I was trying to tell you that there has to be a balance between what was traditional and was rigid at one time, and what should be a little more flexible approach, by trying to assess that it is not just her physical system, not just her body that needs to be nurtured. We also need to nurture the mind of a soul which has gone through a lot. And by giving her the mental and emotional support, and by being a little more receptive of what she's going through, rather than Nikki said, that just asking her to quietly take it. We have to reach out a little more, and don't just work out on the physical aspect of feeding and nurturing, just also reach out emotionally. And for that, we need to have a balance between the traditional and the modern approaches.
Right, ma'am. Agreed. Yes. Now, what are the psychological changes post-birth make this phase so emotionally vulnerable for mothers, Nikki?
See, like I mentioned, Raghavi previously also, psychological changes basically it includes the emotional and the cognitive part. So, when it comes to emotions, if there are extremes of emotions, loneliness or extreme anger outburst, irritation, and mood swings, so these swings, of course, being part of hormonal changes also as a consequence to that, but it could be because of the exhaustion that she's going through, emotional exhaustion, physical exhaustion, right? So, we need to look out for the psychological or emotional changes. These are the changes: anger, there is anxiety, there is she's not talking to anybody, she's just staying to herself. So these are the emotional cues, the psychological cues that we are talking about. When it comes to the cognitive, when there are intrusive thoughts, when there are repetitive negative self talk, so these are the cues that we need to look for, and we need to navigate support to the mother to help her ventilate herself, so that she feels she's being supported, she's being not ignored, she's not suffering silently, and she will be able to channelize her energy to the kid in a better way.
Right. That's true. Right. Okay. How can the healthcare providers remain emotionally supportive of mothers as their roles evolve after birth, Dr. Sandhya?
Yeah. Hi. So, yeah, before I start this, I also wanted to add that in the postpartum care, uh, there's this breastfeeding issues which add to the problems. So, what we have seen in practice is women who are able to lactate well and breastfeed well, they are a little more confident. But the trouble comes when there is an issue with lactation, where either the baby is not latching properly or whether the mother is not having enough breast milk secretion. And then the family uh, somehow, though they should be more encouraging and supportive of her, tend to blame her for not being able to breastfeed the baby or depriving the baby of the breast milk. This is one area where women go through a lot of emotional trauma. It brings about doubt, self doubt, where they come and ask us, am I not a good mother because I'm not able to breastfeed the baby? It brings about a lot of guilt that they are not doing their job properly. But they should be aware that medically there are certain families and certain situations like primary lactation failure, where, in spite of all the effort from medicines and nutrition, the woman may not be able to completely breastfeed the baby, which has to be explained, taken it, understood, and the family should also understand and not taunt the lady about not giving the best care to the baby.
So
This
it
is
can
one
be
area, yeah. We see a lot of family issues, and that becomes the precursor for postpartum depression, which unfortunately she carries with her for a long time. And I've seen women come to us in the second pregnancy, still pointing out what has happened after delivery the first time.
right.
Right.
So
Yeah,
based on this, yeah, please go on, ma'am. Go on.
no, I was about to say, what was the question you asked? Sorry, I went a little detour.
No, please go on. If you have any case studies to discuss, please go on.
No, that's it. I'm done. Yeah,
Right,
you
right.
can.
Thank you, ma'am. Yeah.
Well,
So based on this, how can the peer networks and support groups build resilience among mothers, especially those with limited access to formal care, Ms. Sonia?
I feel see at the very basic level, we already have something called an Anganwadi worker. Anganwadi workers are already working with counseling families and women with the new change that has come into their body.
Right.
When what we can also do is we can bring counselors at the career level, or we can bring counselors at family level who can reach out to the families and tell them about the support that this woman needs, whether it is like very rightly Dr. Sandhya spoke about, breastfeeding doesn't come naturally to every woman. Some have it easy, some do not, and I know so many women who are excellent mothers, but they could never breastfeed their children. They had to straight away jump to the bottle because it just didn't happen naturally for them, right? But all these things have to be explained to the mother, all these things have to be explained to the family, because again, guilty parenting is such a reality. We are all guilty for something or the other at all times. Some of the other corner, we're always feeling guilty about not covering. So this phenomena usually starts off when pregnancy starts off, and then eventually after delivery. So this is where support groups can play a very important role, because when we create a group of women who are going through the same problem, when they meet regularly and they discuss it out,
Mhm.
they realize that this is very, very normal. This is not something which is only happening to them, whether or not they're getting the support from their family about it or not, right? Similarly, a safe circle that a woman can create herself. If let's say somebody's watching this video and they think that then their family, they don't have that kind of support, then they can create that safe circle around themselves with the people that care for them. And they can reach out to them and tell them that, okay, I'm facing this problem, can you come with me to a counselor, can you come with me to a doctor who will be able to guide me further? Because medical help is there, and the awakening towards medical help is also there. People just need to reach out, right? So we have to save her from that isolation, we have to save her from that guilt, we have to save her, like Nikki said, from that negative self talk, which might become obsessive after a certain point. And within everybody, there is this capacity to work towards the positive, to find that fulfillment that motherhood also has to offer. Let's not only talk about the negative aspects. There is so much beauty and there is so much happiness that this bond has to offer. And I think every mother who has gone through pregnancy and delivery and the pain and all of that must go on and feel that fulfillment and happiness, that holding your baby in your arm and being able to feed that baby, nurture that baby. It's such a beautiful, powerful feeling. But that will only come if you get past that emotional stage. And for that, ask for help, whether it is through a safe group, whether it is through a counselor, whether it is through a gynecologist. Reach out.
So the intention has to come out.
Yes.
Intention to seek help and intention to take the help.
Yes. And even if a spouse is feeling that the wife is no longer the person she used to be, maybe that's because she needs a little bit of help, and that little intervention can make all the difference.
Right, absolutely right. Right. So, Dr. Sandhya,
Yeah.
how do working mothers experience identity shifts post maternity, and how can systems better support them?
For
Because if they are the
working
working
women,
ladies,
there are a plethora of issues, so I will go step by step. So first thing what I usually see is that most of them are educated, so they reach out to us for that pre-pregnancy counseling. That part is getting better day by day. From when I have started my practice over the last 15-20 years, I have seen that good number of couples do reach out to us, and that part is decently taken care of. But what is the trouble is the moment they conceive and they start, theory is different, practical is different. So they know there would be nausea, they know there would be so much of fatigue and all, but when they actually go through this, that's when they tend to panic for two reasons. One, the physical ability is coming down, having to cope up in a nuclear family where she has to take care of the cooking, go to work, and deal with her own changes in the body becomes challenging. Second, they have not yet really revealed it to their office colleagues. So, what if they find out? What if I puke in the middle of a meeting? What if I have giddiness? So, that uncertainty is what bothers them. So extreme fatigue sometimes doesn't support them in going to workplace every day. So, most of them usually consider working from home at least for a few days to help cope up. And we do support these people with medicines if needed in case they're really not able to juggle. The second trimester is the happy phase where working women generally get better. They work towards their fitness. There are a lot of classes which they attend for their physical fitness. The baby moons, the photo shoots, everything is done. But when the third trimester enters, again, not being able to go to workplace because of the physical discomfort, the anxiety about delivery process. So that's where a lot of discussions in every visit about the process of delivery, what would be the possible options, especially for pain relief. We do understand that the generations going forward, the pain threshold is coming down. So most of the women discuss about pain relief options during labor, how to make their labor more comfortable so that they go through it a little comfortably. The problem comes when they are all planning for a normal delivery, but due to some other reason, we have to proceed with a cesarean. The acceptance. Now, these are all young women, ambitious, who have achieved a lot in life, but this did not go as per plan. That hits them hard, and I see a lot of women who go through emergency cesarean find it very difficult to accept why I was not able to achieve it. That's where we have to keep them prepared that things can go south anytime in labor, and it is equally important to give a safe baby and safe delivery. It's not always focused on a normal delivery. And then the recovery part, though the current generation is educated, parents have sent them to college, but when the post delivery care comes, everyone wants to go back to the traditional things where they are, like Sonia has pointed out, restricted from going out for 40-42 days, not given proper diet, and this hits them hard. This is where I see a lot of problems in recovery, where they don't find it comfortable with not getting good food, not enough sleep. Most of the spouses are supportive because they are also aware of it, but there are still some husbands who don't interfere much in the childcare when they really want their help. And finally, this postpartum blues and postpartum depression are aggravated if there are breastfeeding issues. Then, a month from delivery, women do cope up very well. They come to us for the follow ups in a nice way, they're talking. But then, 5 months down the lane, when they have to resume their office work, that's when the apprehension starts. Who's going to take care of my baby? How am I going to wean off with the breastfeeding? Do I have to stop breastfeeding completely? So that's where discussing with the pediatrician about the weaning of foods, discussing with the gynecologist or lactation counselor as to how to store milk at home and go to work, or probably if the offices provide a good child care, take the baby there so that they are under their supervision. The breast milk storage techniques, all these can be planned properly. Or if that is not feasible, probably some nanny to take care of the baby. They can train them for 15 days and then resume the work. And the guilt when they go to work. The child is at home, they are not able to perform well because half your mind and thoughts are about what the baby would be doing. Again, technology has come up in a big way where people have installed CCTVs, even if the nannies are there at home, monitoring the child, taking care of breastfeeding. There are companies which give one more year of work from home. That's a very thoughtful thing. And the extension of the maternity leave so that they spend more time with the babies. So, all these can be done if planned in a proper way. But that mother's guilt, in some way or the other, like Sonia has pointed, will be there all through their life. At every phase, you will be missing out on something or the other in your child's life when you have to juggle between your career and childcare. And what is most forgotten about is self care. That's where we also talk to the women that it's not always about childcare. Ambition is important, but self care. Because if that is not done properly, women come to us about an year later, extreme exhaustion, fatigue, vitamin deficiencies, not getting back to their pre pregnancy shape or weight, and that guilt adds to it. They are a physical and emotional mess. So every stage needs counseling, awareness, and proper support from everybody. That's when a woman can go beyond all this and succeed in her life.
Right. So new mothers with the questions, confusion, doubts, distractions is very common. The only thing is
Absolutely.
that right decision has to be taken at the right moment. Right support
Absolutely.
has to be given at the right moment.
Correct.
Right. Absolutely right. Yes. Now, Nikki, the question is to you. If you could recommend one practical tool for emotional resilience in mothers, what would it be and why?
Okay. So, see, when it comes to practical tools to mothers,
Mhm.
we cannot change the society. There is some kind of toxicity in the society. So, rather than changing the system, when working with mothers, I try to tell them to equip themselves with a few tools. So, the very important three tools I'll talk about. One is boundary mapping. You should know when to say no without guilt, to say yes with intentions, and you should know, okay, this is where my energy is leaking and I should stop right here. This is creating a boundary for your emotions, for your own emotional protection. Second
Right.
would be cognitive restructuring. That is a part of cognitive behavioral therapy, where
Right.
there is negative self talk like, am I good enough? Am I a good mother? Am I sufficient? Am I taking care of my child well? So, these questions, when come to mother's mind, so these questions are changed with the help of cognitive restructuring, and we try to bring more accurate stories like, yes, I am I am recovering, I am surviving, and I am thriving. This is a process, and there is no hurry to come out of it. It will take time. So, the cognitive restructuring is very, very important. And few techniques like journaling, deep
Mhm.
breathing, ventilating, and then acknowledging emotions, taking support, asking for support is something, and knowing your strength, that if there is nobody, assessing it well before the conceiving the child has come into this world, assessing, do I have this support? If not, I should be strong enough to face the challenges. So this is where I work upon, where there is no social support and where there is no familial support basically. And creating your own circle, your friends, working with your partner, dividing the responsibilities. And this is where you can not only survive but thrive your parenthood, your motherhood together.
So building the confidence is very important for every individual.
Strengthening the mother's
Right.
strength, focusing on that because she's strong. It's just that she needs to be prepared to face the challenges, and that can be done with the help of the therapist, the counselor, gynecologist, and other people around to provide with the concerned services.
Right. Absolutely right. Yes. Now the question to you, Sonia ma'am. What does authentic workplace support for new mothers look like? And how can organizations move beyond tokenism?
Yeah, I feel that it has to first start with all of us acknowledging the fact that any new baby is not just the mother's responsibility, it is a social responsibility to bring up our children. Whether it is my child, whether it is the neighbor's child, whether it is the child of somebody in my office, it is a social responsibility to build up this citizen of tomorrow because it is this child who has the potential to both become the prime minister or to become somebody who's going to be a negative element in the society, right? Either way, either we stand to benefit or we stand to get harmed in the process, right? So all of us as a society need to be very dedicated and take this as a priority, that it is not just the woman's responsibility to bring up her little one, it is socially our, it is the biggest responsibility of the society to ensure that the next generation is sane and the next generation is protected and they're given the right nurturing practices. So the moment that that perspective comes into play, and that can only happen with time, with the right counseling, with the right mindset being planted at the family, and getting rid of so what, we also went through it in our times, and that thought process needs to change. So, at the workplace, we can extend support to the lady by, like Dr. Sandhya said, by extending the, work from home, instead of just joining back in 6 months, giving her a little more time to, and by no means does it make it simpler for her. In fact, if a lady stays back and works, it adds on to her responsibilities because she's now handling the house as well as the work. But she is willing to get into that with the help of whatever support she can gather around her, whether it is the domestic help or whether it is the family. So as an organization, we need to work on her strengths. It is not necessary that she has to do exactly what she was doing before having the child. If she has better strengths now with her organizational capabilities, or if she has some strengths which do not require her to move around, try to give her the kind of jobs that she can easily do, which she's good at, right? Support that, extend that support. Have counselors at your workplace who can track her movement, track her emotions, track whether she's able to cope with the stress that the workplace comes with, and give her solutions, offer her interventions or the tools and the skill set like Nikki offered. Maybe, have some breathing exercises once in a day, or maybe, like she said, cognitive restructuring, bringing back that authenticity and belief inside her that, I may be faltering, but I'm getting there. Every
That's
day I'm getting better at this job. Every day I'm understanding this even better. And even the best of mothers started this way. Nobody came fully trained. It's an on the job experience. And then accepting her, accepting even if she makes a few mistakes or if she's a little slower than the others, accepting her, because understanding that, um, you know, she's not the same person anymore. Her priorities are not the same anymore. And I would also like to say that not just at the workplace, even at a personal level, this pressure that we've put onto our heads that we have to perform well in all arenas, whether it is work, whether it is family, that we need to get rid of that pressure. For a woman to be working also, to be a good mother also, to breastfeed also, that list has to end somewhere, because she'll just burn out. And if a mother is not happy, the children will never be happy. A happy child means the mother was happy. That child was raised in a happy environment. That child got all the love and affection from a mother who did not have apprehensions and checklists on her head. For that, we all need to work together and support her. And whether it is at an organizational level, whether it is at a family level, or whether it is at the level of a friendship, whether you have a friend who's struggling, we all have to pitch in and help out the lady who's going through this.
Right. So they have to carry the positivity in them throughout their life, every walk of their life.
Yes.
Right. So before we wind up this session, let me give a question to everyone. So the question is, what do you think is the right way to take the Math Resilience program and when it should be started? So let us start with Dr. Sandhya.
I think I have already emphasized the need for pre-pregnancy counseling. Even going forward, probably pre-marital counseling, because there are so many couples who come to us in their pregnancy, and when we ask them, "What's your blood group?" or "What's your spouse blood group?" they don't know. I'm like, "How did you get married without knowing each other's blood group?" As basic as it is. So I think it starts from there, where people not only seeing the horoscopes and everything, but also see the medical history, and not to judge, but to know what precautions to take. And then pre-pregnancy counseling. Contraception is something which is never discussed in our country. So when does this couple want to have a child? Not from first month or second month. If they want to take 2 years, let them go to the gynecologist, approach them, and find the right measures for contraception, and then plan for the pregnancy when the woman wishes to conceive. It should not be enforced on her. It's already 1 year, bacha kar lo. It should not be like that.
Right.
Pre-pregnancy is the best time medically also, because when the egg and the sperm fuse, the fate of the pregnancy is already decided, and there is not much that we can do. So, if proper care is taken to improve the quality of the egg and the sperm by talking about nutrition, lifestyle choices, smoking, alcohol cut down, and everything, stress management, and then when the couple plans, the outcome of the pregnancy would be beautiful. So
Right.
I would start it at that stage,
Very nice, ma'am. Very
pre-pregnancy.
nice.
Yes.
Very. Yes. Next, Sonia, ma'am, the question to you. The same question.
Yes, I agree with Dr. Sandhya that it has to start much before pregnancy. And like Dr. Sandhya very rightly said that, the RH positive, negative, all this needs to be assessed. And unfortunately, it never gets spoken of in our society. Um, I think these tests and this assessment needs to be made, before marriage, or even if there is, a chance that there's some prevention that needs to be put into picture, that because it can ease out the pregnancy that much more, that it can make the process of childbirth that much more easier. And before having a baby, I always feel that bring a baby in a healthy body, that you're be ready to receive that baby. Your body is that vessel which is going to carry that baby for 9 months. Ensure that it is well fed, it is well nourished, it is in the top of your physical state, whether it is through exercise, whether it is through meditation, emotionally, mentally, physically. You should be ready to receive the baby. It should not be, oh, now that I have a baby, now I have to, now what? And go through every phase, feel every phase, enjoy every phase. It is a struggle, but it can be made beautiful with the right support and help. And that is where Matru Resilience steps in, and they can not only help them with the problems that they may be facing today, they can also prepare them for what might be up next. And with the with the research and with the right kind of support and psychologists, the lady can actually go through this entire very, very fulfilling process, and actually make wonderful memories for a lifetime.
Right. Rightly said. Over to you, Nikki, ma'am.
Yes. So I completely agree with Dr. Sandhya and Sonia, ma'am. And being a mother myself, I would say this should start much before the conception, maybe like 6 months, or maybe whenever a couple is thinking, okay, now we are married and we should have kids. They should plan, they should talk to somebody, the concerned person, a specialist. Okay, when it comes to psychology part, so it's like there are psychiatric illnesses. If there is any history of psychiatric illness, they should consider it, because if there is any, see, pregnancy and delivery after birth, these are all major transitions that that a mother is going to face. So sometimes these transitions, these extreme life situations might trigger psychiatric illnesses, because these are going to be challenges or maybe overwhelming for the mother. So one should consider, okay, now am I psychologically fine? Am I able to look after myself? Am I able to engage myself in the day to day routine? If she feels fine, if she feels, then only she should plan for it. She should talk about the physical support, emotional support, the financial status, the financial support if they have, whether now or when they should plan about it. Everything. See, people are so educated, so aware about everything these days. So why not to plan about it? Why not to plan everything? This will be the phase. So this is how we are going to spend. This is where I'm going to give birth. This is the hospital I'm going to choose. They know about everything. So it is much before they should, before conception, they should plan, they should talk to the concerned professionals, and then with the help of the Matru resilience, we can help them with the counseling sessions. We can provide with the sessions with the concerned issues, the psychological help, the gynecologist's assistance, the psychologist assistant, life skills, and everything. So much before, I would say, like I will still stick to this only, much before the conception and even after delivery, for as long as the mother feels I need support, she should be rendered the support from family, from the professionals, and from the society.
Yes. Thank you so much,
Well,
Shikhi.
I'll
All
add
your
to
inputs
that.
are valid.
And I'll add to that very rightly, like Nikki said, human beings take the longest to grow up. They take the longest care and support than, when you compare it to any other species on our planet, there's no other living being that takes care of its younger one or little one as long as human beings do. So why not extend that support to the mother who's going to go through it for a very long time?
Right.
Absolutely, absolutely right. All your inputs are out of the box now, because everybody needs this guidance, everybody needs this clarification, everybody needs this commendation on what they are going through, everybody needs the clarity. How should they resolve all these things at the right moment? So this conversation reaffirms a truth we deeply believe at Method, that healing must go beyond symptoms and reach the heart of lived experiences. I must say this. And thank you, Dr. Sandhya, Nikki, and Sunya, for your presence, your depth, and your insights. Thank you for joining us. Let this be a reminder that every mother deserves not just care, but understanding.
Yes.
So to know more about our details, please log into our website. Thank you for the wonderful session to each one of you.
Thank you.
Thank you. It was a pleasure. Thank you.
Thank you.
Thank you for having us.
Thank you for having us.